May we then move on, please, to the next item, which is the General Practice Services Programme Update. Welcome Ros Rawson, Director of NHS Commissioning, to join us for the paper. Bruce, I think you're going to kick us off.
Yeah. Chairman, I think this is a really important paper, and I think it's important because just under a year ago we published the 5-year forward view for general practice. And we commissioned general practice, which is frankly the backbone of our NHS and has been since its inception. But since then a number of things have changed. Firstly, the amount of knowledge that general practitioners are meant to have has reached the level that we previously thought consultant general physicians should have. Secondly, the patients have become far more complex. And thirdly, there has been long-standing underfunding of primary care, which this board has successfully started to reverse. And all of this is happening at a time that we're trying to treat more patients at home and keep them out of hospital in the face of an aging population with multiple ailments of old age. And this puts primary care staff, and I don't just mean general practitioners, but I mean the full gamut of people who work in primary care under, frankly, relentless pressure. And they feel it on a day-by-day basis. And so this paper outlines some of the progress that we've made since the publication of the 5-year forward view in general practice to relieving some of those pressures, and also outlines some of our ambitions. And I'd like to pay particular tribute to Ros, who's done a huge amount of work on this in terms of engaging with general practitioners, particularly the General Practice Committee of the BMA and the Royal College of General Practitioners.
Ros, over to you.
Thank you. I'm delighted to present to the board an update on our work. As a reminder, when we published the General Practice Forward View last April, we really was designed to do 3 things. Firstly was mark a turning point for general practice by recognising the pressures that it's been under and the relative underinvestment compared to other sectors. Secondly, stabilising general practice under pressure through offering some very practical support here and now. And thirdly, stimulating and supporting general practice to transform, recognising that the nature of healthcare and health conditions and people that they're dealing with are different from 70 years ago. So this paper sets out for the record all the work underway over the last 11 months, and it also includes some case studies which I hope give a flavour of what this means in practice on the ground, both for practices and for patients. I'd like to particularly pull out 3 things. I think first, just on investment, I think it's worth noting that we're on track in 2016-17 for putting an extra £500 million into general practice services compared to the year before. Secondly, on workforce, I think for the medical workforce, I would say the last year we've been particularly focusing on how we can improve return to work processes. So working with the Royal College of GPs and Health Education England, we've really transformed how easy it is for a doctor to come back and work in the English general practice system. So we've got a single point of contact, financial support and streamlined assessment routes. When we started on this work, I think we had about 7 people registered to want to come back. When we looked last month, we had over 350 doctors. So it's been a really significant transformation. It's far more than just the medical workforce. We're keen to support the development of multidisciplinary teams, and this year we've been rolling out clinical pharmacists in general practice, and we're beginning to see the benefits of that, but not just in terms of practice workload, but in the outcomes for patients. And we're trying to capture that so we get what are the key ingredients for when you're bringing a pharmacist into general practice to make the most of that expertise. We'll be working with the Chief Nursing Officer about measures we can take to support general practice nursing, another key part of our workforce. Then the final area I'd like to talk about is about the care, the redesign of care in general practice. I think many people have talked to us about the need not just to stabilise general practice, but to support practices in taking the next step for transformation. there's real bottom-up momentum out there, particularly around practices coming together to work at scale, around using the wider workforce, around working out how general practice can enable self-care and using the latest technology. So we're really delighted to be supporting that bottom-up movement out there with the National General Practice Development Programme. We've got 86 schemes now registered, so this is practices that have come to us to say they want to do stuff, and that covers about 107 CCG areas in the country. So this programme highlights things like the 10 high-impact actions that practices can take, and we offer support to them in taking those steps, which help improve the experience of patients. I think earlier this month we held an event with about 500 participants from practices, local medical committees, patient groups, commissioners from all around the country. And this wasn't about NHS England saying these are the things you can do. This was about local places and local people talking to other local places and local people about changes that they've made that have made a difference and how they've done it and what's made a difference. So we heard from places talking about how they've trained up staff to kind of care navigators, so people that can help patients access all the community and voluntary sector groups out there. And we're seeing for those cohorts of people reductions in their use of general practice time, in their use of A&E, in their use of public sector resources, and happier people. We've heard work about redesign of workflow within practices. So we heard from practices talking about measures they'd taken that were freeing up around 45 minutes per doctor per day in their practices. So really concrete things that we hope will free up GP time to be able to manage the most support the most complex patients and improve access then for the whole body of patients. And then thirdly, we heard about ways in which practices can work together at scale and what the point of working together at scale is. So I think one of the key things that coming out from our network of at-scale general practice networks is about the difference that's making to staff retention and staff development. So the ability to employ a wider range of disciplines across a bigger population, and that makes for a more attractive career, creates better resilience in practices, and helps to improve patient experience. I think what's exciting is how much energy there is out there to take forward changes, but what general practice needs is support to do that. And that's why in the General Practice Forward View, we continue in the year to come in making sure that we continue to increase investment, but increase that in a way which supports the kind of changes that we need to see for the future. And that in turn, I hope, will help us to improve access to the for patients to general practice, which is the key sort of number one piece of feedback that we get from the public about what differences they want to see in the years to come.
I invite some comments and queries. Noel?
I'm going to speak on behalf of NHS Digital, if that's okay, Ross. Enabling this programme with the technology strategy that you pick up in your document is one of the three major priorities for NHSD this year, so it's definitely put its shoulder to the wheel, as it were. And one of the most important elements is the ability to share records across different patient settings and into care settings and into community pharmacy, etc. Could you just say a little bit about what you think the benefits to patients will be of a more open way of using this technology to share patient records?
Yeah, so I think very practically, if we talk about extended access, so being able for patients to get access to GP appointments at weekends, which is something that we're very committed to doing. What we know is we can't expect, it would be wrong to expect every practice to be open every day of the week. So what we're looking at creating are extended access hubs. What we know from past experience of improving access in general practice is that if a patient goes to a place that doesn't have access to its record, it then can't, as it were, have perhaps the referral on if that's what's needed. It may simply be kind of dealt with as an urgent thing and then told to go and see its normal, their normal GP or their normal practice during the week. access to the record, obviously with all the appropriate governance and consent around that, will mean that patients, if they go and see a practice or extended access hub at the weekend, can be dealt with fully in that one episode rather than needing to return again and to the NHS later. So that's a very practical thing that I think where that would help.
Thanks, Ros. Really important piece of work. Could you just give some highlights or examples of, as a consequence of the change in activity that's happened in a number of areas, what have been the improvements for patients and citizens that you yourself have seen?
Yeah. So I think one of the kind of areas that I think has really been bottom up is about how do practices connect with the wider community and particularly with voluntary sector groups. And what we've seen there is patients that were perhaps coming into general practice maybe every 2 or 3 weeks and with a kind of complex, it was really general practice with a sort of biomedical model wasn't the answer for what they needed. So actually being able to support those patients in finding the other parts, other things that were in the system that could help them has been really important. And what we've seen is that then those patients sort of not really needing kind of the NHS, but actually being able to start supporting themselves, and that in turn leading to them feeling much more kind of positive about their potential and ability to achieve what they want to achieve with their lives. And one of the things that we've also seen in that is actually getting supporting patients in the practice to become those practice champions. So almost building up the general practice, not just as the staff that work in it, but actually the members of the practice so you kind of get a kind of self-generated support across all the people that are using that service. And I think when we think about the new models of care, if you see general practice in some parts of the country can be a natural hub for population-based healthcare, that is not going to work unless you've got the wider community sector involved.
Okay, thank you.
So, Ros, GP 5-year forward view was an immensely important strategy for us. So I think it's really illuminating to see how it's rolling out. If you were doing a self-assessment of our success over the first year, what mark would you give us out of 10?
Well, I have very high standards, Chairman. So I would probably say 8 out of 10, in that I think we've changed. I think we've kind of changed the mindset about actually what we need to do is make things happen in general practice, pay attention to it. That I met with the BMA yesterday, and I met representatives from LMCs all across the country. And I think the debate that we're having is how can we go faster, how can we make more of a difference? And what I hope is we've kind of shifted the mentality a bit more to being, how do we take control of this to shape the service that we want? Because as we all know, that everybody that comes to work in general practice is trying to do a good job and a great job for their community. And I think that what I hope we're beginning to see is that we're trying to support them in doing that. So, I mean, there's still work to do, and we have, we've done a real assessment about the areas where we think we can improve next year, and we're putting steps in place to make sure that on some elements of the programme where we've not gone as fast as we would like, that we start, on the 1st of April 2017 with really tackling those issues so that we can deliver fully in 17-18.
Okay, well, thanks for that. And obviously, we'll keep a close eye on that and assure ourselves. But I think full marks to you and your team for what's been achieved. I mean, likewise, I detect that sort of change in mood music around general practice, and a belief that the additional investment and the additional interest that we're paying to general practice is starting to be understood and bringing about the change that's needed. So, David.
Ross, I think we all accept that significant underinvestment in general practice has been going on for a number of years, and therefore it's a number of years to correct that. And I think, you and your team, as Malcolm said, have done an outstanding job in getting a lot done in a short period of time. I think the delivery plan, I take it tomorrow, we know is going to have a major focus on general practice in its broadest sense. And I guess a sort of an observation as much as anything, which is certainly, the board is completely focused on making sure that you've got what you need to be able to execute. And therefore, not just, I'm interested not just in the balance of investment, but also in the balance of how do we make sure that the 45 minutes to an hour a day, which is precious time, how do we get that promulgated around the system as a whole? How do we help hard-pressed GPs to have the time to be able to, and the resource to be able to implement those changes in a way that, because obviously it takes time to make change, to make things better for them. So have we got the right sort of support package in place to help practices improve, get better, free up time, to allow more time for patients?
Yeah. So I think when we think about this, we think about there are kind of three ingredients you need. You need will, so that's kind of convincing people that this is something that they want to do and this will work. And I think that isn't everywhere yet. So that we have for some of these things, there's quite a sceptical audience. So actually working on this can make a difference to you. And that requires peer-to-peer conversation is by far and away the most effective. The second is about ideas. And I think that we've now collected tens, if not hundreds, not quite hundreds, but of case studies that we're working through both from a clinical patient experience and economic business perspective about what does that translate into the difference to make sure these are ideas that are really grounded in evidence. And then the third is execution. So I think that in terms of execution capability, I think that the general practice sector has got a longer way to go than
it's really
other
tough
sector.
if you're running your own business, you're seeing patients, you've got all those demands. So I'd encourage us to think about what type of support we can make available, because it's sort of will and skill, and actually the skill and time, how we can help people to do that. And I think Malcolm says, you should be demanding of us to give you the support that you need.
I think one thing that's kind of important is that in everything that we do, so when we're thinking about leadership development or any of the kind of broader initiatives that we do, that we think about the general practice sector as being part of that, not separate.
Correct.
And I think that's one of the things that has shifted, but there is still a way to go. So I think when I think about management trainees in the NHS, have tended previously to go to the trust sector.
Yeah.
So I think that if we want to see a general practice sector that's got the capabilities to do the kind of improvements that the public need and practices want, then we need to kind of mainstream more some of our broader efforts. And when we talk about the provider sector, we need to be thinking general practice as well. And I think that's things that we've moved in the last 12 months.
And general practice not being just doctors, but also
absolutely
nurses, practice managers, etc.
And I think what we're seeing as kind of the point when Michelle's question is actually seeing the people registered with general practice as part of the kind of part of the workforce almost.
Right. Well, thank you, Ross, very much for the presentation, and may we just wish you well for the next year of delivery.